Hello and welcome to a special interview for The Wire. A major controversy has broken out between the World Health Organization and the government of India over India's actual COVID death toll. The Indian government insists that as of today, it's 522,000. The WHO has estimated it almost 8 times higher at 4 million. The Indian government has disputed that figure. It's questioned the WHO's methodology and it insists that the WHO figure should not be made public. And that raises the critical question, who's right? And as far as we in India are concerned, who's wrong? To help me answer that question, I'm joined by a London-based mathematician who has been tracking India's COVID epidemic and in particular India's COVID mortality, Murad Banaji. Dr. Banaji, on Saturday, the New York Times published a story claiming that the WHO believes that total COVID deaths in India are 4 million, which is roughly 7.6 times more than the official figure of 522,000. Now, as someone who's been analyzing COVID deaths pretty closely, does the 4 million figure sound right?
Yes, it does broadly sound right. I would just like to clarify that I believe that the estimate is of excess deaths. So I don't think the WHO necessarily would claim that they can confirm that these are all deaths from COVID-19. However, this is what the estimate is for India's pandemic excess mortality. So these are the extra people that they estimate to have died as a consequence of the pandemic and during the pandemic. And that 4 million figure actually, when you look at the literature on excess mortality in the pandemic in India, that 4 million figure sounds very plausible to me. In fact, it's close to a number of estimates from a number of published papers and preprints. It lies very much in the range of these other estimates. So I would say it comes as no big surprise or shock.
In fact, just to build on that point, there have been, I believe, 6 separate studies, and the total COVID mortality estimated by those 6 studies falls in a range between 3 million and 5 million. One of those was, in fact, a study done by you. Doesn't this mean that the WHO figure, which is slap bang in the middle, has added credibility because it's corroborated by these studies?
Yes. Yes, there are a number of studies, in fact, and I mean, most of them do give figures in the range between 3 and 5 million. There are some which go a little lower. There's one, I think, which comes to a figure of 2.7 million. There is one which goes quite a lot higher at 6.3 million, but the majority of estimates lie in the 3 to 5 million range, including my own work with Ashish Gupta. We come to a kind of median estimate of 3.8 million in that. I think that yes, the WHO estimate, the fact that it lies in this range does give it additional credibility. It's probably not a coincidence because the WHO are no doubt looking at the same data sources that all the other researchers have been looking at. So including civil registration data, perhaps data from various surveys, perhaps data from other kind of government systems which monitor mortality in the country. So if you're looking at this data, it's actually very hard to come to conclusions which are vastly different from the numbers that we're seeing here. It would be hard to arrive at a much, much lower estimate based on this data. And yes, it does add to a volume of evidence that mortality has been very high, pandemic excess mortality in India.
Now, according to newspaper reports in India, the Indian government has responded fairly strongly in disputing the WHO figure. I'm going to quote from a statement issued by the Indian Health Ministry. It says, and I'm quoting, India's basic objection has not been with the result, but rather the methodology adopted. And it seems from newspaper reports as well as from that statement that there are 4 key concerns, and I'd like to put each of them to you one by one. First, the government says that the methodology used for assessing COVID deaths in tier 2 countries, and I'll add for the sake of the audience that India is deemed to be a tier 2 country, cannot apply to India because of the size and scale of the country. And they're talking both about the population as well as the area. Do you accept that point, that the methodology used for tier 2 countries cannot apply to India because of its size and scale?
No, I mean, it's very hard to be precise and to give a very precise answer until the WHO report is actually out and available for scrutiny. But broadly, the methodologies that one adopts for trying to estimate excess mortality are much the same. I think what makes India somewhat different is that you have gaps in the data. So you have patchy data which is available from some states, but not all states. For example, civil registration data is not uniformly available. So there has to be some element of trying to reconstruct a national estimate from what is called subnational data, so data which is coming from some regions of the country. And obviously, in that process, there are going to be some uncertainties which are introduced. And there are a variety of ways of trying to take account of those uncertainties. So it's not a new problem where you're trying to fill gaps in data. This is a very kind of common problem in analyzing this kind of data, as I understand it. And the methodologies which have been adopted have actually been put out in the public domain by the researchers who were working with the WHO. And as far as I was able to glean from looking at those documents, they look like very reasonable methodologies.
I'll just underline for the audience that the methodology used for calculating excess deaths is virtually the same in all countries. The problem in India is the patchiness or the incomplete nature of the data that's available. And that, in a sense, takes me straight to the second concern the government has. The government says that you cannot extrapolate from the 18 states where different media or academics have done excess death calculations to the whole country. And this is because states differ from each other, sometimes very considerably. Would you agree with that, that you cannot extrapolate from 18 states to the full 28 states that comprise India?
Well, first of all, I think it would be important to ask numerically how significant are these 18 states. I don't know actually what is the full list of states which were used by the WHO, but in my own research, from what I've looked at, there is decent data available from states and regions which comprise more than half the population of the country. In fact, around 60% of the population of the country in the data that I looked at. So we're not talking about extrapolating from regions with 5% of the population of the country. We're talking about numerically very significant large regions. Of course, yes, there have been some differences in how the pandemic has evolved in different parts of the country. And there are always going to be risks with extrapolating to a region where you don't have good data. What are the differences that we have, between different regions? It's important to be kind of clear about these. We have differences, for example, in development. We have differences in the availability of hospital care. We have differences in age structure. So we have some states with younger populations, some states with older populations where you might expect higher mortality as a consequence of the more elderly nature of the population. But what we don't have is massive differences in terms of the spread of COVID across the country. And that we can see quite clearly in the later sero surveys, which showed that with perhaps a couple of exceptions, COVID had spread fairly evenly and very widely across the country. So when it comes to that particular question of do we expect lower mortality in some states because the disease didn't reach there, I think the answer is actually no. The disease reached most parts of the country before the vaccination drive. And so the mortality that you are estimating seems to be consistent with that widespread. So no, I wouldn't take that objection. I wouldn't dismiss it because I think it's important to be careful when you're extrapolating, but I wouldn't say that it's a critical objection which makes this work unreliable.
Again, I'll pick up two very important things you said. The data that's available is from states and union territories that comprise 60% of the country's population, and therefore extrapolation should not be such a problem. And secondly, although there are differences within states, there wasn't a key or critical difference in terms of the spread of COVID. And therefore, although extrapolation is difficult, it's not a critical objection. Let me then come to the third problem the government has. And this time I'm quoting directly from the statement the Health Ministry released. The test positivity for COVID-19 in India, they say, was never uniform throughout the country at any point of time. But this variation in COVID-19 positivity rate was not considered for modeling purposes. How valid is this objection?
Well, to me, it sounds like a very confused and confusing objection because I'm not really sure what the test positivity rate has to do with modeling the spread of COVID. if it's meant to stand in, if it's meant to be a proxy for how much did COVID spread, if we're going to try to read that information out of the test positivity rate, then I think, no, that's not the right way of going about things. I think we have seroprevalence data to tell us about the spread of COVID. So I'm not really sure what the point is that's being made with test positivity. It's a very complex measure to interpret. It varies very widely depending on your testing strategy. It varies depending on, the moment that you're at in the epidemic, and obviously epidemics go up and down, and test positivity goes up and down with those kind of waves of the epidemic. And I really don't see how it can be used to better inform these estimates of mortality, because mortality is something really quite specific that I understand is trying to be estimated here.
I'll point out for the audience that, in fact, the last nationwide seropositivity surveys done, which I think was done in June of last year, showed a seropositivity level of 67.8. And since then, there have been regional and local seropositivity surveys done that have shown levels of 80 and even 90%. I believe the one for Delhi was pretty much above 95%. So, by the way, that is clearly an indication that if the seropositivity level was so high, the spread was greater, and therefore it's possible there were more deaths as a result of the greater spread that we don't know about. Let me
Can I just interrupt you for a moment? Just to clarify, I would say the last one was the 4th National Sero Survey. That was the last one which was carried out largely before vaccination had become very widespread. And it actually also broke down the data according to what was the seropositivity amongst people who had been vaccinated and amongst people who had not been vaccinated. I think after vaccination has become very widespread, it's a bit harder to interpret the results of sero surveys because there's an increasingly small unvaccinated population, and obviously we expect the vaccinated population to be on the whole seropositive as a consequence of vaccination. But yes, the 4th National Sero Survey in May to June of last year showed very high positivity, even amongst those people who had not been vaccinated.
The point you made is absolutely correct, but I'll simply add that a 67.8% seropositivity level actually suggested, and I'm saying this from my memory, that we were perhaps missing 20 or 25 cases for everyone that we were detecting, which means that the spread was far greater. And that also could suggest that the number of deaths that follow from people getting infected could have been many more. Let me then, am I right on that?
Yes, absolutely.
Let me then come to the 4th objection. And this is a particularly peculiar one. The government claims, and once again, it's the Health Ministry's formal statement, that the WHO has assumed an inexplicable inverse relationship between monthly temperature and monthly average COVID deaths. Now, I believe the WHO modeler, who's a pretty internationally renowned epidemiologist, John Wakefield, has explicitly tweeted to say that no such inverse relationship is involved in the modeling. He's made it absolutely clear, so he's completely contradicted this point made by the Indian Health Ministry. The Indian Health Ministry has not responded to that contradiction as far as I know. They are silent. So let me ask you, what do you make of this point?
So I have no inside knowledge of this part of the, because I haven't seen the WHO report. But yes, Professor Wakefield has released a document which details exactly, or at least some of the details of what was done in the case of India. And I think he's made it very clear that they didn't use global data to make estimates for India. They used Indian data to make estimates for India. So it wasn't that they were using a so-called global covariates of mortality to estimate India's mortality. It was, these estimates were based on Indian data. So I imagine that once the report is published, if the kind of stalling comes to an end and we finally get to see it, it will be much clearer and it will be much more easy to actually answer questions about, well, how did the WHO arrive at the Indian estimate? But yes, I believe the researchers have denied that that particular allegation that they used variables which were kind of derived from global data to set Indian mortality levels.
Let me, for the sake of the audience who aren't aware of the details of the Health Ministry statement, read out the specific sentence regarding this allegation, which I'll repeat, John Wakefield has explicitly denied. and to which, i.e. to that denial, the Indian government has not responded. This is the allegation made in the Health Ministry statement. The model assumes an inverse relationship between monthly temperature and monthly average deaths, which does not have any scientific backing to establish such peculiar empirical relationship. Clearly, in that sentence and in the second half, the ministry is actually accusing the WHO of doing something that has no scientific backing and which is trying to create a peculiar empirical relationship. So that's a pretty strong charge from the Health Ministry against the WHO. When the WHO denies this and does it very forcefully, then the silence from the Health Ministry becomes very questioning and peculiar. Because when you make this serious charge of being unscientific and the WHO refutes you and says it's not true, then you need to actually defend why you made the charge. Silence from the Indian Health Ministry is disturbing, isn't it?
Yes, and I think there needs to be a kind of proper open debate, scientific debate, which is freely visible to everybody in the public domain about these things. Because after every one of these published papers on mortality, the PIB has issued some kind of press release and often actually calling the scientific work misinformed or speculative and other kind of pejorative words, but without really putting these allegations up for proper scrutiny. So it hasn't really given the researchers a right of reply to these claims that their work is misinformed and speculative. And it seems to be that the same kind of epithets are being used about the WHO work. And obviously, once the WHO work comes out in the public domain, there may be valid criticisms. We can look at those. Everybody can look at those openly. And until then, it seems a bit pointless to have this kind of a discussion.
Quite right. The Health Ministry has made accusations without backing them up with evidence, and when those accusations have been denied, it's also failed to defend them, which leaves the Health Ministry in a rather peculiar situation. But let me now come to what I believe are the consequences or the implications of this dispute and controversy between the WHO and the Indian government. I'll start by quoting the New York Times article which broke the story on the 16th. The paper says the WHO's efforts to calculate the actual global death toll has been delayed for months because of objections from India, which disputes the calculation of how many of its citizens died and has tried to keep it from becoming public. This means clearly that the Indian government is holding up the WHO's work, doesn't it?
That's what it seems to mean. And again, I'm assuming that that's correct, that the New York Times report is correct, because nobody, as far as I've read, in the Indian government appears to be disputing that version of events and saying, no, we're not holding it up. In fact, everybody seems to be agreed that there's been back and forth between the Indian government, between the Ministry of Health and the WHO, Statistical Commission, or I think it is, which is in charge of this report. It seems that that is what is actually delaying release of the report. The WHO has kind of put out some diplomatically worded statements about how this kind of robust discussion is important and it makes the report better in the long run and that it will be released soon. But I still gather from that yes, there has been a delay.
Now, the second implication is something that you suggested yourself at that answer, the back and forth between the Indian government and the WHO. The government claims, and again, this is in the Health Ministry statement, that it has raised objections with the WHO in 6 separate letters and 4 virtual meetings between November the 17th last year and March the 2nd this year. And it adds that it has not got a satisfactory response. That phrase, satisfactory response, seems to be the key word, because it suggests to me that they've got a response, but it's not satisfactory because they don't like it. And they don't like it because the WHO has not conceded their objection. Is that interpretation from me more or less correct?
Well, obviously, I don't know what's been going on behind the scenes any more than you do, Karan, but I mean, that's the way I would interpret it. I would interpret it as the WHO has definitely been communicating with the Indian government. There's probably been discussions about the methodology and about the science and the way that these estimates have been arrived at, but ultimately, perhaps they have not conceded the point that their estimates are too high And this has upset the Indian government, the Ministry of Health.
We're coming to the end of this interview, Dr. Banerjee, but let me pull out of the immediate controversy and instead ask you how you believe the WHO views India's COVID death figures. In an interview that he gave me on the 13th of January, Prashant Jha, the internationally well-known epidemiologist, who I believe is also part of the WHO's technical advisory group, told me literally in so many words that the WHO distrusts India's COVID death figures. Do you also believe that to be the case?
Yes, well, I think Professor Prabhat Jha would have a much better insight into that, being on the technical advisory group. But I think it would be right to distrust official COVID death numbers from India, because we both have a lot of evidence for why they are considerable underestimates, but we also have an understanding of how this has come about. We've seen with more kind of detailed ground reports how it's possible to actually miss a large number of COVID deaths, the great majority of COVID deaths, particularly in some states where the kind of process of COVID death recording has been particularly weak. So it's not just that we have data showing that this has happened, we also have an understanding of how it has happened. We have a lot of global context to see that, yes, this does happen in some other countries too. It happens to different extents in different countries. So it's not a problem unique to India, although the scale seems to be particularly bad in India in terms of what fraction of pandemic deaths have been missed. So I think, yes, it would be right for the WHO to be extremely cautious about taking India's official COVID-19 death numbers at face value. And indeed, every independent scientist that I have spoken to who has any understanding of this matter would agree on that.
My last question, if India continues to refuse to acknowledge the actual COVID death toll, and that certainly seems to be the case for now, what are the important consequences that will have?
Well, I think there are so many different ways to try to answer that question. Obviously, there's a question of accountability. There's a question of we have to understand how the pandemic unfolded in order to be able to understand what went wrong, in order to be able to mitigate against the same things happening in the future, in future pandemics, or perhaps even in future waves of this pandemic. So obviously, there's that issue of understanding. There's the issue of taking responsibility. There's also the issue of kind of scientific integrity. I'm really worried about the kind of what implications this has for Indian scientists and the scientific community when, scientific work, which I think is good quality scientific work, is being disputed because it doesn't say the right things, because it doesn't align with the government perspective on the pandemic. The scientific work is being kind of rubbished in the public domain, rather than being critiqued in a kind of more cautious, more academically kind of academic context, let's say. So I think it's got a lot of implications that this has become a controversy at all. Okay, yes, you can have disagreements about the detail, you can have disagreements about the methodology, but this needs to be conducted in a way which is appropriate to the setting, which is this is academic work, which is being conducted to try to understand the impact of the pandemic, and obviously incredibly important for India and Indians to understand what happened.
Of all the consequences you mentioned, let me just pick out one. You said this is also an issue of scientific integrity. In other words, India's refusal, obstinate refusal, it'll soon become, to accept the actual COVID death toll will raise question marks about how India views science and how scientists and academics abroad view Indian scientists and Indian science. That is not a happy position for any country to be in. And I'll add to that, this is in a sense underlined by the fact that the actual press statement released by the Health Ministry is in semi-literate English. It's not, I know, the national language, but nonetheless, if you are going to refute a body like the WHO, the least you can do is make sure that your language is correct. All of that is not a happy situation for the country, is it?
No, I mean, and it's worth saying that a lot of the academic work that actually informs our understanding of COVID mortality, it's been done by Indian scientists, the great majority of it. It's come out of India. The data has been gathered by Indian journalists. The actual analysis has been done by Indian scientists working in Indian institutes. So it's not that this is analysis and data which is coming from abroad. All the kind of the preprints and papers which have been coming out so far. It's really important to recognize that these objections are not coming from India in some abstract sense. They're coming from the Indian government. And I think that a lot of people, including the people who work on mortality in India, are very much aware that official COVID-19 deaths do not reflect the pandemic toll in India. But what is worrying is that, of course, this pits scientists who are working independently and trying to work to the best of their ability and with integrity against the government and perhaps a small minority of government-aligned scientists who are very bent on pushing a particular line. And I think that is a very unhealthy position for science to be in India at the moment. And obviously, it's also unhealthy for science to be perceived that way in the wider world, Indian science to be perceived that way.
Dr. Banaji, thank you very much for this interview, and thank you very much for speaking so clearly about the situation we face today. Take care.
Thank you very much.
Stay safe.
Thank you.